Hi 各位午安，多謝你哋一齊嚟參加我哋今日嘅論壇。We are going to be talking about vaccine today, and with us today will be our guests from the Department of Public Health, Dr. Peter Chin Hong and myself. 今日我哋係有4位由呢個市立嘅健康部嘅嘉賓嚟參加，同埋陳子平醫生嘅。咁我咧就係Diana Lau，劉雪艷。咁我就係呢個加大亞裔健康研究院嘅主任。So I'm Diana Lau, the director of the Asian Health Institute at UCSF. With us today are 4 guests from the Department of Public Health. They are Dr. Sunny Pak, Veronica Vien, Victor Lim, whom many of you know, and also Katy Tang, which many of you know too, because Katy used to be our the Sunset District supervisor. And Victor, he's kind of famous in the community because you see him on television. So he is actually the COVID Command Center API Outreach Campaign Manager. 三藩市疫情指揮中心亞太社區嘅外展主任。Victor, your Chinese name is 林偉豪嚇。Correct. 林偉豪主任。係。咁佢亦都係 SF-Dem External Affairs Officer。DEM，yeah。So 係三藩市應急管理局嘅外務特派專員。咁係好歡迎你參加。So Veronica is the Public Information Officer for the Department of Public Health at San Francisco. Hello, Katy. Can you introduce yourself as to your new role at the city department?
Sure. I am the Director of Public and Governmental Affairs at Department of Public Health.
Great. Thank you. And so welcome to all of you. So Dr. Pak is the Medical Director of our Chinatown Public Health Center, but he knows a lot about the functioning of the Department of Public Health and the vaccine distribution and all that. And he's supported by Veronica and Katy and Victor today to talk to us about the vaccine situation in San Francisco. 白幹榮醫生咧就係而家等緊佢整晒，佢係我哋三藩市華埠嘅公共衛生局嘅醫學嘅醫療主任嚟嘅。咁佢就今日我哋好高興佢抽時間嚟到同我哋做呢個講座。咁佢同埋3個同事一齊嚟幫我哋手解答各位嘅問題，同埋講下關於嗰啲疫苗嘅情形俾我哋聽嘅。因為三藩市同其他嘅城市都一樣啊，都係個疫苗嗰方面咧都係即係有啲混亂咯。咁不過而家情況似乎好咗啲啦。So we are eager to hear the vaccine situation in San Francisco, which would probably be pretty similar to those of you who live in the other counties in the Bay Area also.
All right, so basically this is sort of the outline of the presentation. We're going to talk about vaccines overview, distribution process, and some of our accomplishments and challenges. 咁大家好，我係白醫生，就環保衞生局局長啦。咁想同大家講今日基本上係我想講嘅嘢就係想講翻疫苗嘅即係大概係咩一回事啦，同埋而家疫苗點樣去大家分配俾大家。而家基本上我哋可以做到嘅，同埋而家有啲即係基本上有咩難處咧，想同大家分享下。Of course, there are 2 vaccines that everybody knows about, Pfizer and Moderna. That's what we're all the ones that we all know about. It's being shipped, and so 基本上我哋而家主要係有2個疫苗啦。第一個就係輝瑞㗎啦，另外一個就係 Moderna 嗰個嘅。So the first thing, of course, the vaccine is safe and is effective. Basically, we know that both of them have about 94 to 95% efficacy. I know Diana is going to talk a little more about that later on. It is based on large clinical trials, all gone through phase 3 clinical trials, and it should be very good at protecting you from the virus. 咁第一件事想同大家講就係個疫苗咧，基本上係安全，一定係安全同而且咧係有佢嗰個係可靠性，而且係一定有個基本上有個保護性嘅，係經過咗好多唔同嘅即係我哋佢叫 phase 3 trial， 就而且係一個稍微龐大嘅已經做咗即係測試，所以唔係話將呢啲疫苗咧嚟到而家俾大家嚟到去先至試下係有冇用，其實已經知道係有起碼94%至95%。 嘅安全性同埋係而且係有效性㗎啦，94%至95%係有效。而且係可以保護到你嘅基本上同呢個病毒咧係有一個保護性喺嗰度。咁我陣間可以講話點樣保護法。So the vaccine was developed very quickly, basically because been working on this particular family coronavirus for years. They did not have to work from scratch. In fact, I can add a little bit. I just heard from a talk from there was an interview with Bill Gates with their Gates Foundation that they actually have been funding this particular type of mRNA research for the last 10 years. That's actually the reason why, because it was developed so fast. So 咁基本上咧呢個疫苗咧係有咁快可以做到出嚟咧，因為平時疫苗係應該要好多年先做到一個疫苗出嚟嘅。但係今次我哋喺短短1年之內已經做到嘅原因咧，就係因為基本上我哋醫學界同埋科學家咧，就係喺呢個新冠病毒嗰方面咧，呢個新冠病呢個所謂叫新冠狀病毒啊，冠狀病毒咧基本上我哋已經科學家同埋醫學家咧已經有好多年嘅經驗做緊㗎啦，所以基本上我哋唔係話由零開始嘅。咁我亦都近排聽過同我哋 Bill Gates 嗰個講過有個訪問啦，就其實根本佢嗰個慈善機構咧Gates Foundation 咧已經講呢個所謂叫 mRNA 嘅疫苗咧已經做咗成10年咁耐，所以點解我哋咁快可以做呢個疫苗咧？原因就係咁解。So as I was saying, we're working with Pfizer and Moderna, and it is safe, 94%, 95% effective. It's been working for many years. So I was at the point of stating that every study, every phase, and every trial was reviewed by FDA and the Safety Board. So 基本上每一個階段，每一個做嗰個測試咧，我哋 FDA 嗰邊即係藥物同埋食物管理局咧，都係同埋有一個監管嘅機構、安全監管機構係睇過晒先至俾佢出嚟俾我哋市民去用嘅。而且我哋知道即係有稍微大嘅反應咧，基本上咧係十分好少嘅機會有咁嘅發生。So serious side effects are extremely rare. The vaccine, of course, as everybody would be hearing on the news, is a critical tool to slow the spread of COVID-19 and basically end the pandemic. 咁其實大家都知道啦，疫苗當然係其實一個除咗我哋做測試之外，係一個基本上最重要嘅其中一個最重要嘅途徑，嚟到將呢個病毒咧去嗰個傳播去減慢佢減緩嘅嗰個傳播性。佢基本上已經將呢個整個大流行嘅問題咧去終止佢嘅。So most of our patients, of course, is getting their vaccines from their insurance provider. And at this point, of course, general public will not be able to get, it's not basically going to be available until latter part of 2021. I know we have some hiccups in terms of distribution right now. Another issue is that we're not recommending it for children. Basically, hasn't been studied enough yet for children. And then COVID-19 vaccines are free, basically covered by insurance. And even if you are not covered by insurance, the city is doing their best to try to give you the vaccine. So the whole idea is to be able to vaccinate as many people as possible. So, but one thing is very, very important. I want to stress that even after you're vaccinated, you still need to wear your mask, adhere to physical distancing, and thoroughly wash your hands. 基本上咧，希望到2021年嘅中旬到啦，就大家普羅大眾所有人咧都希望會有得到呢個疫苗啦。就其中一個問題而家咧就係嗰個新冠病毒嘅疫苗咧，就未係準許係俾小朋友去做個接種嘅，因為基本上佢哋未做嗰個測試咧，就喺小朋友嗰邊咧未做得足夠。而且呢個疫苗咧係基本上對大家係免費嘅。當然個驗收公司會盡量會幫俾付呢個費啦。就算你冇驗收的話咧，我哋政府咧會盡量亦都俾到呢個疫苗俾大家。咁亦都想同大家呼籲同埋講咧，就係就算你接種咗疫苗之後，都一定要繼續戴你嗰個口罩啦，同埋繼續要保持嗰個6尺以上嘅距離啦，同埋繼續要勤洗手嘅。 咁我陣間會講解點解。I think Diana's probably gonna go into it as well as to why that is the case。好啦，咁我哋基本上 what's the pathway of distribution？ 我哋呢個俾呢個疫苗係點樣嘅途徑去俾我哋所有嘅普羅大眾咧？基本上咧 ，so the state and the federal government are driving and prioritizing the allocation process. So I want to stress a few words here: state, federal government, and prioritization. So DPH itself does not decide who gets vaccinated. We are basically following the guidelines from the national and state recommendations on how we prioritize and allocating the doses. So we are responsible for only administering the vaccines that is delivered from the state to San Francisco to the public. So we're just delivering. We're not responsible for saying who gets it first or who gets it later on. We have to follow the guidelines from the state and the government. So 咁我哋想基本上我想講就係我哋三藩市衛生局咧，主要係跟住州政府同埋聯邦政府嘅指引嚟到去話邊一個市民係優先要得到就基本上咧因為我哋攞到嗰個疫苗咧，就係從州政府度攞到啦。咁然後我哋主要做好嘅咧，就係將攞到嘅疫苗咧，就接種俾我哋應該接種嘅市民。就我哋跟住州政府話應該要接種俾邊一個，我哋就做俾邊一個，我哋要做好呢一點。OK， 呢個就係我哋嘅最主要嘅任務。Okay, so here is more of a overall pathway on how the vaccines get into SF. As you can see, basically the federal government is purchasing. You hear President Biden saying that he's getting millions and millions of vaccines, and then it's being allocated to the state. Where you can see that there's also federal pharmacy partnership, and then there's also another arm that is devoted for the VAs. 好啦，咁我哋見到咧就係聯邦嗰邊咧就主要就買晒，盡量買到幾多就買到幾多我哋嗰啲疫苗啦，之後咧就分配俾我哋州政府，亦都喺聯邦嗰邊咧同埋我哋啲不同嘅藥房嗰邊咧，就佢哋就有一個合同，同埋大家做一個伙伴咧，亦都喺希望可以經過即係藥房嗰邊亦都可以俾市民啦。同埋第三個步驟咧，就係第三個途徑咧，就係可以希望經過所謂叫做 VA， 即係基本上係退伍軍人嗰方面咧，係可以接種到俾嗰啲退伍軍人嘅。Okay, so from the state then it gets to multi-county and then also the local governments。好啦，咁然後由州政府嗰度咧，就先至分配俾不同嘅我哋嘅不同嘅縣啦，縣政府有不同嘅計劃啦，去點樣去。就除咗不同縣嘅政府之外，亦都係當然市政嘅不同嘅衛生局都去將嗰啲疫苗係俾市民嘅。咁譬如入到去縣嗰方面啦，當然亦都 So after we get to the county, we're going to distribute it over to different medical entities such as Kaiser, Sutter, Dignity, UCSF, and of course, SFDPH is also one of the healthcare providers. And then the rest of them is the other last bit of that slide is talking about how it's continued to working with the local pharmacies and the VA。好啦，咁由縣嗰邊咧就分配去俾Kaiser啦、Sutter 啦、UCSF 嗰邊啦、Dignity 啦，所有啲稍微大嘅醫療機構啦。咁當然我哋三藩市衛生局咧都係其中一個醫療機構係收到呢啲疫苗嘅。So we're talking about phases now。好啦，咁頭先so we're talking about phases because we just talked about how we're following the guidelines from the state and the federal government on how we're prioritizing the different vaccinations, right? So we're going to go into that now. What are those phases? 咁頭先我所講啦，就係要我哋係跟隨嗰個州政府同埋所講嘅個優先邊去優先啦，就變咗優先的話，就變咗有一個時間表啦，就邊個打先，邊個打後。So it's divided into phase 1A, 1B, and then within that there's tier 1, tier 2. I don't have time to go into details, but basically in phase 1A, as so many of you have heard, is targeted to achieve basically the highest priority populations, such as those who are either in the healthcare workers and are 65 and above or 75 and above, basically reaching the critical population. The reason why they are critical, as you can see, is that we're targeting those who are affected by this COVID virus the most. You see on the left, on the right, I mean. Those who are dying of COVID-19 are those, as you can see, basically age 60 and over. especially those who are 80+. So that's why that population is most important. So 咁基本上我哋點樣去分配點為之叫優先咧？基本上我要用我不同嘅資料咧，知道咧我哋而家呢個新冠病毒咧最影響到最大嘅咧就係60歲以上，尤其是80歲以上嘅市民咧，多數佢哋死亡者咧都係咁嘅歲數以上嘅。咁所以點解我哋要先俾咗佢嗰個疫苗俾佢哋先？ Okay, of course, when there's a large doses available, then we reserve it to the public. 好啦，咁接種咗俾啲稍微長者之後咧，其他之後先至俾普羅大眾。I'm not going to go into the tier 1, 2, and 3, but basically it's basically telling you that the first phase is talking about healthcare workers, different types of healthcare workers, all the way from those who are working inpatient to paramedics to dialysis center to outpatients and to pharmacy, dental, and even to mortuary services. 呢個咧就講第一最主要咧，我哋要保護到接種疫苗俾我哋醫療人員先啦。除咗喺醫院裏頭做嘅，或者喺我哋診所做嘅，甚至去到做牙醫啊，或者喺做藥房啊，甚至做我哋殯儀館嗰啲，因為佢哋點解咧同我哋接觸所有會對新冠病毒會又好稍微近佢哋嘅接觸，所以一定要保護佢哋先。如果唔係的話咧，冇咗佢哋醫療人員咧，就基本上所有啲人都得唔到嗰個醫療嘅服務啦。Okay, so 1B and 1C, what is it? So then when we get to phase 1B, we're talking about vaccinating those who are basically 65 and over. So of course, tier 1 is 75 and over, tier 2 is 65 and above. And even then down to 1C, and we go down on age, 50 and below and all of that. So 基本上而家去到第一 B 期之後到同一 C 咧，就開始就頭先我所講啦，嗰啲長者啦，65、75歲以上嗰啲，然後先至去俾50歲以上嘅，咁當然一定要俾75歲以上嗰啲先啦。基本上而家嚟到講咧，我哋係喺 phase 1A 同 1B 就即係啱先我哋州政府先至話係俾65歲以上嘅咧，亦都可以開始接種呢個疫苗啦。So as the state also announced 65 and older just earlier this week. We're going to also vaccinate those who are 65 and above. But I do want to emphasize on upper right, this is subject to change. This is, it really depends on the data, how we want to help with different age groups. It also depends on the numbers. And so yeah, and we're just trying our best to work with those who are at most risk. Now, I do want to emphasize, just because you are eligible, it does not always mean that you can get the vaccine, and that's mainly because there's still a limited supply. I want to add this a little bit here. So 我想中文講咧就係，雖然我頭先所講話長者65歲以上、75歲，尤其是嗰啲係需要應該係優先㗎啦。但係因為而家我哋疫苗咧製造嗰個量咧都有限，咁所以雖然你係應該係優先係得到，應該係輪到你㗎啦，但係咧因為嗰個有限的話咧，嗰個疫苗有限咧，有時咧可能未必你一定會得到嗰個疫苗，所以咧即係點解我哋要盡快將叫所有嗰啲製造疫苗嘅廠咧，盡快做得越多越好咧？原因就係咁解，希望佢哋越整越做得多啲嘅咧，如果冇一個限度的話咧，咁個個都要得到呢個疫苗。
基本上白醫生講係供不應求而家嚇，雖然你合資格嘅話，但係未必好難排到隊，即係意思係供不應求係。
係冇錯，多謝。供不應求。Okay, so we're going to go into DPH and the strategy. So because we have limited supply, what we're going to do? So again, another important thing that we want to stress, one of the guiding principles is that we want to, it is also based on equity, speed, and partnership. 除咗頭先我所講話供不應求之外咧，亦都我哋衛生局咧要基本上係盡量可以用一個最公平嘅辦法，同埋而且係最快嘅辦法咧，同埋睇下我哋可以同邊一個伙伴咧，等可以喺最短時間內咧係俾到呢個接種疫苗俾需要嘅普羅大眾。So I mean, if you look at the rest of the slide, basically it's talking about the same thing. What we need to base on is also looking at metrics, outcomes, and the different general information. And what we want to do, of course, to be transparent and visible to the public and partners. 咁啊另外我哋衛生局最主要想要知道嘅咧，就係除咗我哋睇住不同嘅數字去俾個指引俾我哋應該點做之外咧，我哋盡量會做到嘅就係盡量有個透明度啦，幾時俾邊個，同埋係我哋有幾多即係個供不應求嗰個係點樣供不應求法，同埋盡量可以話俾佢聽幾時俾到大家嘅。Okay, so this is a diagram of the strategy. So the city gets the vaccine, the distribution. So there are 3 different places that we're thinking of doing. We're going to set up the high volume vaccination sites, the community vaccination sites, basically clinics and mobile hubs and mobile vax clinics, and also pharmacy. 咁我呢度睇到就係市政攞到呢啲疫苗之後咧，基本上係盡量喺用3種不同嘅途徑。第一就係我哋會去製造一啲即係所謂叫做 high volume， 即係盡量要好大供應率，可以做到好大供應率嘅接種疫苗嘅地方啦。There's one such as the one over City College, UCSF, that is in partnership with UCSF. I think we're setting one up with over at, correct me if I'm wrong, Veronica, the one over on Mission 24th is another one, high volume one, I believe. Correct me if I'm wrong. And then the other 另外一個途徑咧就係 community vaccine access sites， 好似譬如我而家喺我哋做嗰個第4衛生局啦，同埋有時如果我哋有不同嘅有車輛去周圍去最需要嘅地方度可以做到呢個接種疫苗，我哋會咁做啦。同埋第3就係用嗰個頭先我都講過啦，就係用藥房啦，藥房如果可以做到一個我哋而家聯邦嗰邊咧同藥房咧係例如 Walgreens 啦、CVS 啦，都會希望之後咧佢哋得到嗰個疫苗就可以俾到大家。
One of the high volume vaccination sites, which you are correct, is the City College one. As for the Mission, the one on Mission Street, that is one of our community high volume sites. So you are correct that it is more community focused.
Right. 頭先所講就係啦，喺我哋市政嗰個大學啦，市政大學 City College 同埋頭先我所講喺 Mission 嗰邊都係盡量可以俾到，即係每日可以俾到好多接種到好多個疫苗嘅。咁而家基本上係準備緊啦。當然我啱先開始做緊呢個話咧，就可能要俾少少時間佢哋可以將嗰個運作咧去做得更加好。
Another high volume site is actually going to be at Moscone Center South. It's partnered with Kaiser and other partners, and that will open tomorrow. 另一個高量嘅呢個叫做接種疫苗站咧，除咗喺市立大學嗰個總行嗰度咧，就係包括埋喺我哋而家疫情指揮中心 Moscone Center 展覽廳個南廳嗰度咧，就同 Kaiser 同埋其他嘅醫療機構咧一齊攜手合作，由聽日開始咧就會啟用。咁最高個量度咧可以每日咧接種俾1萬人嘅。So the high volume site at the Moscone Center South, when it is completely fully running, we anticipate to also vaccinate up to 10,000 people. Thank you.
So this slide, as you can see, basically that's what Victor was talking about. On the left, you see the City College Moscone Center, and then there's another one, SF Produce Market. There's a planning underway. Then you can see that some of under SF Health Network, there are not only is General Hospital giving the vaccine, Laguna Honda is doing as well, and some of the clinics like Maxine Hall, Ocean Park, Southeast, and Chinatown Public Health Center, they're doing it. There's some neighborhood sites, such as 24th and Cap, and then that's also in partnership with UCSF. We're definitely working another neighborhood site, even the Safeway Pharmacy over at San Francisco State. And they are targeting a specific population for those like right now for age 65 and over, of course, those who go to a Safeway Pharmacy. Then there are other partners such as Chinese Hospital, NEMS, One Medical, and Healthway 360. And then finally, of course, I already mentioned about Kaiser, UCSF, Sutter, and Dignity. 咁我哋睇到啦，除咗頭先林專員所講嘅喺市立大學之外啦 ，Moscone 啦，亦都我講到就係喺San Francisco Produce Market， 即係基本上我哋唔喺個唔係賣雜貨啊，唔係咁講，
唔係即係菜批發市場，
菜批發市場，唔好意思，係菜批發市場。咁嗰個咧而家係籌備緊嘅。咁亦都其他呢個我哋可以俾到vaccine嘅地方咧，亦都係除咗總醫院之外啦 ，Laguna Honda 啦，咁 Maxine Hall Ocean Park， 我哋第4衛生局 Southeast 啦，亦都喺稍微我哋不同嘅區域裏頭咧 ，24th Street and Cap 嗰度有一個啦 喺三藩市市政大學嗰度 San Francisco State 同埋裏頭有個 Safeway 嘅 pharmacy 咧，就亦都可以俾到啦。當然我哋其他伙伴例如東華醫院、東北衛生、東北同埋One Medical Health Right 360都有，咁亦都頭先我所講過啦 ，Kaiser UCSF、Sutter 同埋 Dept。好啦，咁我而家講究竟我哋做到幾多咧？今日嚟講，嗱，我哋而家見到呢個圖片咧，就係2日前2月2號咧，基本上喺左邊嗰度咧所講到咧，就係喺三藩市居住嘅人，大約差唔多7萬人咧已經接種咗第一個接種疫苗，第一針。咁然後咧第二針咧差唔多去到18000人已經接種咗啦。咁當然呢個係2日前嘅數字，今日嚟到講當然會亦都已經更加多啲。我頭先好似約莫睇過咧，你見到嗰度話9%嘅人已經即係18歲以上係接種咗咧，今日已經去到10%啦。咁而且話喺成人嚟到講，已經接種咗即係打咗2針嘅咧，唔係已經2%，係已經3%。咁好啦，喺右邊嗰邊咧睇到話幾多已經喺三藩市市內已經接種過咧，成日去到成11萬咁多。點解個數字會有唔同咧？因為好多人咧唔係住喺三藩市，但喺三藩市工作，亦都喺三藩市度係接種到呢個疫苗嘅，所以個數字係會係稍微更加多。即係市民就已經接種咗，頭先我所講啦。就算唔係市民喺三藩市工作嘅，我哋亦都幫手接種咗，所以咧已經受成11萬人咧以上已經係接種咗嗰個疫苗嘅。What are the challenges? Well, there was no federal plan, and so there's no unified federal or state system for vaccine delivery. That has changed now with our new president, and that's being basically it's being in the works right now. So we're unclear how many vaccines will be allotted and when, because it's a production issue, and also it's a purchasing issue. And then the state and the federal guidelines are evolving, just as you heard. At first, we're saying we're going to prioritize 75 and over, then we're going to switch it over to 65. And so that's evolving. Sometimes the data quality and consistency and timeliness of the data from the state is also not the greatest, because we're still setting up the infrastructure to capture that data. Now, counties are moving at different speeds. And I want to talk about this a little bit, why that's the case. So some of you might hear that maybe Alameda County, they're already moving much faster. And that's because San Francisco, as you heard earlier, what the state wanted to prioritize is healthcare workers first. San Francisco is one of the counties with the highest number of healthcare workers. I believe we have about 20,000, correct me if I'm wrong, 200,000, sorry, 200,000 healthcare workers. And that we have to get through that first before we can get to the public. We're trying to do it at the same time with 65 and 75 and over. And so therefore and because we're allocated, pretty much a similar number of vaccines, that's why to operationalize all of that, it's going to take at different speeds. 好啦，咁就所講話，而家我哋基本上有啲咩難題啦？就頭先我哋都知道，我哋新總統上任之前咧，基本上我哋聯邦同埋州政府咧冇一個話合力一齊做點樣去將呢個疫苗咧係俾到我哋大家嘅。基本上每一個省、每一個市、每一個縣可以得到幾多疫苗咧，亦都未知數，亦都好即係不同嗰個 Pfizer 又講，Moderator 又講，佢哋製造呢個頭先我所講供求率嗰度咧係未必一定佢哋可以就俾到嗰個製造到個疫苗啦。州政府同埋聯邦政府佢個指引咧，亦都喺度不停每一日要睇下因人而異，同埋因嗰個不同嘅需要而喺度變緊嘅。咁例如頭先我所講啦，本來就係話得75歲以上，而家要俾到65歲以上咁樣。咁我哋一變咗的話咧，咁我哋亦都要隨住咁變的話咧，亦都係幾辛苦下。咁而且加埋我哋嗰啲不同嘅資料點樣去攞到呢啲資料的話咧，而家基本上我哋係盡快咁將嗰個吸取到呢個資料嗰個辦法咧，亦都未必一致，亦都未必一定話係規範化啦。咁所以變咗有時啲資料咧未必一定係正確，咁亦都係一個問題。亦都不同縣嚟到講，好似譬如知道話喺阿拉米達縣，點解佢哋已經可以接種到多啲稍為長者，但係我哋喺三藩市會慢啲咧？原因就係因為我哋三藩市自己本身頭先我都所講啦，我哋希望將所有啲醫療人員咧係就接種咗俾佢哋先， 然後先至俾長者的話咧，咁我哋喺三藩市裏頭咧有成差唔多20萬咁多個醫療人員咧，咁係就係稍微係一個好龐大一個任務嘅。咁所以要做咗嗰個先的話咧，變咗就會慢咗少少，先可以俾到我哋不同嘅市民啦。So and we also are collaborating with different major providers such as you heard UCSF, Sutter, and all that. So there's a lot of coordination going on. And then basically you also have to do two doses, not a single dose. It's not like a flu shot. And not only that, actually I can say a little bit about how when we are, it's different from giving a flu vaccine. It's not just you just give a vaccine and you go. You have to, after you give the vaccine, you have to monitor them for 15 or maybe even 30 minutes, depending on the patient. So that takes it's actually slows it down quite a bit. And we have to also maintain social distancing, right? We can't just have a whole bunch of people lining up close to each other just to get the shots. So that's really difficult. And we have to space it out 3 to 4 weeks apart, depending on the vaccine. So all of that, including the fact that some of these vaccines need to be frozen at very low temperatures. So it's very, very difficult for us to operationalize this. 好啦，咁講到最尾個難題咧，就係基本上我哋要同不同嘅醫療機構一齊要做呢個接種疫苗啦，同埋加埋你要想像就係話同比打流感疫苗唔同少少，就係通常以前打流感疫苗的話打咗咁佢走得咁就算數，但係而家呢度咧就係你打咗之後，亦都要睇住每一個人佢有冇反應，有咩唔尋常嘅反應要等起碼15至甚至要30分鐘以上先至佢哋先可以離開。加埋又要打2針，又要話除咗3個禮拜、4個禮拜之外，咁所以要再加埋就係而家呢個輝瑞同埋 Moderna 嗰個疫苗咧，係要儲藏喺十分好凍嘅儲藏，係零下70度咁樣或者零下20度咧，咁所以係一個難題嚟嘅。咁主要就係咁樣啦，呢個就係最主要嘅難題。咁我而家就講晒不同嘅嘢。咁多謝大家。Thank you very much, and I'll turn it back to Diana。俾翻 Diana 先。
Thank you so much, Dr. Pak. That was a lot of information. And thank you for the rest of the team. We know that Chinese hospital has been doing testing for the community at Proxima Square, and they mainly test the people in Chinatown and the people who live there and work there. So there's some recent increases. It used to be 0. You test the whole SRO building and it was like no infection for a few times. And then they start to have more cases. So this is a question from the J Medical Group that I received today. They want to know what can the city do about the situation.
Thank you, Diana. I'll answer in both English and Chinese. 咁剛才Diana 就講到咧，有關最近咧見到喺我哋華埠啲散房或者甚至乎三藩市啲散房咧，可能有呢個確診攀升嘅。So first I'll answer in English, okay? So the work that we've done to respond to SROs in Chinatown or even throughout the city, we have an SRO response team and also an SRO task force. The SROs that are in San Francisco are located within Chinatown, the majority of them, and also in the Tenderloin and in the Southern Market area. 咁首先咧，我哋而家市政府咧喺疫情指揮中心同埋三藩市衛生局咧，就有一個呢個叫做散房嘅應變小組。咁咧就而家係專門咧應對喺我哋呢個華埠區域嘅呢個散房咧確診嘅病例啦，同埋喺田德隆區，甚至乎喺南 Market 街區舊工廠區嗰邊嗰啲散房嗰度就派我哋啲職員同事或者我哋社區嘅機構咧去回應嘅。So how it's worked is that we have seen certain cases. I cannot give you the exact addresses due to HIPAA protections, but we know that there are some SROs, for example, in Chinatown that are reoccurring with cases. And also we want to thank Chinese Hospital, NEMS, NICOS, and also the CBOs for having a rapid response team to go into buildings that may have one or more cases that are positive. Currently, the medical definition of an outbreak would require 3 cases within 2 weeks from three different units. 現在嚟講咧，我哋譬如喺三藩市華埠嗰個應變咧，我哋首先要多謝就係東華醫院啦、東北啦、第4衛生局同埋呢個 NICOS 咧，佢哋而家有個應變小組同我哋社區啲專員咧就上樓。如果一旦知道某個地址有確診1個病例或者以上嘅話咧， 我哋會派人上去嘅。咁如果按照衛生局嘅標準咧，係要3個唔同嘅門牌號碼，有3個獨立嘅病例咧，就屬於一個爆發。呢個解釋咧，同喺社區嘅角度咧，當然有少少唔同。咁喺社區僑社嘅角度咧，如果見到一個 case 喺嗰個呢個散房咧，都非常之關注嚇。So with that said, that is why in late October, actually the day before Halloween, we finally established a weekly COVID testing site at the Portsmouth Square in Chinatown, and it's been a great success. Right now, we are operating from 10 to 2 every Wednesday. And we also want to let everyone know that if you are a frontline worker, if you're a DSW worker, a uniform staff, if you work for one of the CBOs with the employee badge, we do expedite you because you have a very narrow lunch time frame. Also, we arrange many of the SRO tenants that may come from a building that have 1 or more cases of COVID to also be expedited to get the testing. And yesterday, Sing Tao actually had the opportunity to interview some people that have done the test for 5 or 6 weeks, and they are SRO tenants. So from the first time that they were very scared of doing the test to now it's actually become a second nature, like tying your shoelace. So 喺華埠嚟講咧，我哋好高興咧，就因為我哋見到啲確診嘅案例咧攀升咧，咁嘅原因可能係好多嘅，咁但係我哋嘅源頭追蹤組咧，佢哋會有多啲嘅資訊。但係咧喺10月底嗰陣時，喺呢個萬聖節之前咧，我哋第一次喺10月30號就舉辦咗我哋嗰個嘅檢測啦，喺花園閣嘅上層嘅。咁自從我哋做咗嗰2次嘅首次檢測，個反應非常之熱烈咧。我哋亦都由12月份開始，每個禮拜3 10點至2點咧，都係免費提供檢測。如果你係我哋嗰啲非牟利機構嘅人士啦，我哋前線工作人員啦、制服團體啦、執法人員啦，嗰啲如果有工作證嘅人士咧，就可以特快，因為你哋食飯嗰個時間咧，休息時間係非常之狹窄嘅。其餘咧，我哋都係有安排咧一個特快嘅檢測，係專門為如果我哋知道邊個散房公寓佢係有呢個案例嘅話咧，嗰啲居民咧都有一個特別嘅宣傳單張咧，係嚟到咧，我哋會安排佢哋特快檢測嘅。Diana, I hope that answers part of the question.
So we know that you have hotel rooms to house some of the infected people. Do those residents in the SROs get to be assigned to the hotels?
Yes, that is a great question. So also since last September, we've arranged with COVID Command and DPH to ensure that, especially for cases that we identify from the Chinatown pop-up test site, that for the isolation and quarantine I&Q team, that we can try to expedite the process to allow them to go to a hotel room. Although we cannot tell you the specific hotel, we have ensured the public that this hotel is within walking distance in Chinatown. It is actually located in Chinatown. And we've also arranged culturally competent food to provide for the meals for the entire duration that the person requires to be isolated and quarantined at the hotel room. Because when they live in SRO, they cannot fully isolate due to the sharing of the restrooms and the kitchen. 咁有關頭先等人劉姑娘問嗰個呢個散房同埋呢個疫情隔離酒店咧，我哋而家市府咧就係有幾棟嘅唔同酒店係安排咗安置啲確診人士嘅。呢啲酒店咧專門係為嗰啲譬如住喺散房或者佢哋嘅 apartment 有好多唔同家庭而無法完全自我隔離咧，就安排佢哋係全面嘅免費食宿嘅時間同埋供應嘅。咁亦都好高興咧，就可以同大家分享，我哋呢個酒店咧喺華埠嘅某個地方咧，確實位置唔可以公開咧，因為呢個醫療私隱條例啦。咁但係咧我哋都安排咗有適合我哋華人傳統口味嘅1日3餐提供俾嗰個人士需要進入呢個酒店嘅。而如果佢哋啲家人係譬如想自己送飯啊，或者俾啲衣物啊，其他嘅日常用品咧，都可以俾我哋啲職員咧安排帶上去嘅。And the last thing is, if they are at the I&Q site, and if the family members wish to or friends wish to bring food or personal belongings to that specific person, our colleagues on site can actually take the the food or the clothing, and then bring it to the hotel room for that person that is isolating for the duration required.
Great, thank you so much. I want to thank all of you for the good work that you're doing at DPH. I know it's an unprecedented situation and everybody's trying to do the best. And thank you on behalf of the community and keep up your good work. And thank you for coming and joining us for the town hall today. 多謝各位係三藩市公共醫務局嚟到今日同我哋參加呢個講座，同埋佢哋係做一啲非常之好嘅工作嘅。希望你哋繼續努力，加油！ So let me turn over to Dr. Peter Chin Hong on the other part of the vaccine stuff so that we learn more specific stuff about the vaccines that we're dealing with. Dr. Peter Chin Hong, welcome, and thanks for joining us. So this is a slide that is for the US, looking at the infection rate changes. So can you please talk to us?
So it seems from the US curve that we are definitely on a downward trajectory in cases. We have, like California, the number of new cases have decreased by 21% in the last 2 weeks. But also we're seeing fewer hospitalizations, and the deaths are sort of stable, but the deaths always take a little bit longer than the others to be reflected. What it means is that, we didn't see as much as the New Year's surge as everyone worried about. Most of it was due to Thanksgiving and Christmas.
咁陳醫生咧就係話其實呢個疫情咧而家暫時嚟講咧係好轉咗嘅。我哋見到咧就係有呢個傳播率咧係減低咗，就係我哋以為佢仲會繼續高嘅，因為新年啊佢都好多人走埋一齊啊嘛，我哋以為佢會繼續高嘅，但係咧佢可能係因為已經開始打咗疫苗咧。就將個疫情咧就拉低咗，所以而家已經證明到呢個疫苗咧係有作用嘅喺個社區嗰度。咁當然咧就而家我哋仲係喺美國嚟講啊，每一日都仲有好多人有新病例啦，同埋咧就係個死亡率咧亦都係非常之高嘅，係即係從此以來未有過咁高嘅，係差唔多每分鐘係有成3個人死亡嘅。咁但係咧希望呢個疫情咧如果係有呢個疫苗控制嘅時候咧，就會繼續轉好。咁我哋而家睇下將來嗰幾個禮拜嘅情況係會改成點。
There are different ways of making the vaccines. I'll start with the two main ways in the US that we've seen them. One is, of course, the Pfizer and Moderna are messenger RNA vaccines. So they produce a message, they deliver a message to the cells, and the message is to make spike proteins, and our body develops antibodies to these spike proteins. So when the main COVID comes, it can stop it. So it's not the COVID, it's no live, it's just a message to one part of it, which is the outside spike. So that's Pfizer and Moderna.
咁咧呢個咧就係我哋知道做疫苗咧有幾種方法嘅。咁我哋而家喺美國用緊嗰種咧就係Moderna 同埋 Pfizer 呢兩個輝瑞同埋呢個Moderna 呢兩個疫苗啦，就係用呢個蛋白嘅核糖核酸嚟到製造嘅。
So the next kind of vaccine is what we call a vector vaccine, is a adenovirus vector. Adenovirus is a virus that causes the common cold, but it's not a live virus. It's killed or inactivated. So this virus is just carrying the message or the genetic code to the cell. So in the Pfizer Moderna, this message is in a fatty bubble and it goes over directly. In the AstraZeneca and J&J vaccine, it's the same genetic code, but it's using a virus to take it over like a spaceship. The spaceship takes it over to the cells, but the cells make the same thing, the spike protein, and the body develops antibodies against spike protein. So again, for AstraZeneca and J&J, the cell's still making the spike protein, but it gets into the body in a different way through a spaceship, like another virus, which is killed.
咁呢個第二個方法咧就係即係傳送嗰個蛋白核酸係 核糖核酸嗰個方法咧，係同第一個嗰個方法唔同咧，就係第一嗰個方法咧，就係嗰個核糖核酸咧，就係俾一個脂肪嘅膜包住佢，好似個罩咁樣包住佢啦，咁咧就傳入去我哋嘅細胞嗰度嘅。但係第二嗰種咧，佢咧就係好似有隻太空船咁樣，就係將裏邊將嗰啲核糖核酸咧喺個太空船裏邊，咁由個太空船咧就唔係即係上一個嗰個脂肪包啦，就用個太空船咧就帶去我哋嘅細胞嗰度。咁始終都係將嗰個核糖核酸咧就帶咗入我哋細胞嗰度啦。不過即係坐嗰個交通工具唔同啦嚇，一個就係脂肪包，一個咧就係用太空船。
And I'll just mention that there's other viruses like Novavax coming down, but in China, the Chinese vaccine, there are two main companies in China. It's Sinovac and Sinopharm. They are kind of a traditional vaccine, so it's the whole virus. It's just killed, and they give it to you, but not the message. In the other vaccines in the US, it's just the genetic code, just the code for the spike protein. In the Chinese vaccines, it's the whole virus is just killed.
So 喺中國嗰度咧有幾種疫苗嘅，其中嗰兩種咧就係用一啲即係將嗰個病毒係將佢係滅活咗，叫滅活病毒。咁然後咧就係嚟到做呢個疫苗嘅，但係呢個即係同嗰啲用嗰個蛋白核糖核酸嗰個方法咧就係唔同，因為嗰啲咧就唔係成個病毒傳入身體嘅，但係咧中國嗰度其中兩種咧，即係佢唔係全部都係，佢都有核糖核酸嘅，但係其中最主要嗰兩種咧，最快而家就嚟出嗰兩種咧，就係用嗰個滅活嘅疫苗去做嘅。
And then the Russian vaccine, it's more like the AstraZeneca and J&J with the spaceship, the adenovirus vector.
Right. 咁蘇聯嗰度都有一種出咗一種疫苗嘅，叫做 Sputnik。咁呢個疫苗咧就係即係好似係坐太空船咁再入去嘅，即係同嗰個牛津大學同埋中國嗰度都有一個疫苗係咁樣，嗰個 CanSino 嗰個都係咁嘅，同埋J&J 強生嘅藥廠嗰個又係用嗰個太空船嘅方法入去嘅。
In general, the Chinese vaccines have not performed as well as the other vaccines in these traditional methods because it's thought that the virus is killed, the body's immune system is not as activated as in the other vaccines.
咁咧，中國嗰啲滅活嘅疫苗咧，可能喺我哋身體嗰度咧就帶唔起咁大嘅作用反應啊。咁樣所以咧，佢哋嘅疫苗咧，可能嗰個功能咧就比較低。比其他嗰啲疫苗低啲，但係都唔係冇用嘅，都有用嘅。So this is a slide, Dr. Chin Han. This is a slide that we used before on the bottom part. That was on December 15. We used the bottom part, and there was 81 vaccines being developed at that time. And so then a few weeks later, on January 4th, we have 95 vaccines now. So you can see the little circles. 81 and 95. That's the number of vaccines being developed. And then they are in different stages. And so you can see the three phases, but the only phase that we are really interested in are phase 3, actually, the darker blue. And so you can see that there were 16 vaccines in phase 3 before, and now it's 20. And then those are the approval stages in green and red. And, the red ones are the abandoned. The green ones are the ones that are approved fully or by limited use. 咁呢個圖咧就係講個疫苗開發係有幾多隻疫苗喺度開發緊咧？而家全世界呢個係全世界嘅，係而家暫時嚟講咧就有95個疫苗。其實佢係一路咁轉嘅，有啲加入去啦，有啲即係做唔到啊，走翻出嚟啦咁。咁而家有4隻疫苗咧已經係甩咗出嚟㗎啦，或者係暫時停咗唔做嘅。咁咧就有總共有10隻8+2啦嚇，就係10隻疫苗係全世界裏邊啊係有。即係俾人係准許去使用嘅。So Dr. Peter Chin Han, you want to add anything to this?
Yeah, so there are only 2 approved vaccines in the US right now, but the closest next one is J&J, which we expect to be approved sometime later this month. And that's just the 1-shot instead of 2-shot vaccine.
So J&J is one of the 20, right? In phase 3 right now.
But that may soon be approved. And then
Right.
around the world, the AstraZeneca is already approved in the UK and parts of Europe and in India, but not in the US yet. The Chinese vaccines are approved in China, and the Russian vaccine is approved in Russia.
Right. So the approval, the 2 approval, I think we're talking about the US only. There are vaccines approved by other countries and elsewhere, and we didn't count those in. But anyways, 即係呢個係陳醫生咧就係話喺中國啊、蘇聯啊、歐洲嘅地方咁、英國啊咁都有其他嘅疫苗咧係已經係批准咗用嘅。咁但係佢哋咧就即係我哋冇計到佢哋嗰啲擺喺度。我哋而家綠色嗰兩個嗰8個加2個嗰兩個咧就係喺即係美國嗰度用嘅，係有2個疫苗而家係，但係咧就好快嘅將來咧就會可能會有多啲疫苗咧就快可以加入去喺美國嗰度可以用噶啦。
It's important to talk about the world in vaccines because we can't just take care of the virus by ourselves. Until the whole world is vaccinated, the economy can't go on because the virus can just come, and cross the borders. It doesn't care what country you live in.
呢個真係非常之重要嘅環節咯，就係我哋唔可以淨係顧自己。如果我哋淨係顧自己嘅，淨係美國有疫苗嘅，其他世界都冇疫苗，嗰啲疫苗始終係會走翻嚟美國，嗰啲病毒會走翻嚟美國再感染我哋嘅。咁所以咧就如果係想將呢個疫情控制咧，我哋真係要宏觀咯，就係全世界觀咯，就即係要係貧窮嘅國家又好，富有國家又好，都要有疫苗。貧窮嘅人又好，富有嘅人又好，都要種疫苗。咁所以呢個病毒咧係帶俾我哋一個即係好大嘅啟發嘅諗法。
And I guess one last comment is that part of the vaccine strategy from the big countries, particularly China and Russia, is to donate the vaccines to many parts of the world. So it's almost like vaccine diplomacy, trying to make friends with vaccines.
咁就係喺中國同埋蘇聯咧，佢哋都捐咗好多嘅疫苗咧去其他嘅世界嗰啲第三國家咧，咁咧就係希望全個世界咧都可以得到疫苗嘅。
This slide is Operation Warp Speed. So it's the governmental effort in the United States under the Trump administration to fund a lot of therapies for COVID. Most of it was vaccines, but some of it was for antibodies, like what President Trump gets. And the antibodies is kind of like what we do in our bodies make in vaccines, except you're giving somebody else's antibodies in those treatments.
咁呢個就係講嗰個即係我哋而家有嘅疫苗咧，就係主要咧都係由呢個Operation Warp Speed 就係呢個快速嘅計劃嚟到製造出嚟嘅。咁而家咧有6個係批准咗，有5個咧就已經係喺度嚟做得非常之好啦。其中2個已經用緊啦，另外嗰3個咧就繼續喺其他嘅國家俾批准啦，或者美國就嚟都批准噶啦。咁咧就係只係有一個咧就係跌咗出嚟。咁但係呢個 Sanofi 同埋GlaxoSmithKline 跌咗出嚟唔做之後咧 ，Sanofi 咧而家咧就會幫呢個Pfizer 嗰隻疫苗咧去製造唔知幾多百萬疫苗咁樣嘅，所以佢就算唔做咧，佢都係幫其他嘅公司去製造疫苗。
The main point for the community to know is that the name Warp Speed doesn't mean that the science was sped up. It's just that the bureaucracy was cut down so they can come to the market soon rather than later.
咁咧，主要我哋想你知道嘅咧，就係好多人咧都好擔心話，點解咁快有咁多疫苗？點解唔係10年、8年先至有疫苗？好似其他嗰啲疫苗咁樣。咁咧呢個快速嘅計劃咧，我哋想你知道咧，並唔係話我哋即係嗰啲科學家做得快咧，就將嗰啲 要做嘅嘢程序咧就減咗唔做，並唔係咁樣樣，只係佢哋將其他好多嗰啲繁文縟節啊，或者嗰啲政府嗰啲紅帶啊咁樣將佢盡量簡單化，將佢容易啲，等佢可以即係等佢可以過關咯。即係過關嘅程序簡單咗之後咧，咁佢嘅科學嘅研究咧就會更加係做得快速嘅。咁即係主要嚟講，呢個計劃係咁樣，我哋就唔想你諗咧，就係話哇咁快，咁即係有啲嘢未做啦，咁其實就唔係咁嘅。So this is a listing of 12 of the most common slides that are doing very well, and so you've seen some of them already. Pfizer, Moderna, and then you know about the Oxford AstraZeneca and Johnson & Johnson and Novavax. Those are the 5 vaccines. They are part of the Operation Warp Speed. And then you have 3 of the Chinese vaccines, Sinopharm, Sinovac, and there's another Sinovac Wuhan. I guess that's a little different. And then you have, CanSino also. And then you have the gamma layer, that's the Russian vaccine. And so these are a bunch of vaccines in the world that are being developed, and they are just almost to the using, approval stage, if not already. Dr. Peter Chin Hong?
Yeah, so my main point about this is that there are a lot of vaccines in the world. They all have different ways of working. They all have very different efficacies. But again, we have to vaccinate the whole world if we have to really control this pandemic. And part of the mission of COVAX, which is sponsored by the WHO, is to help to subsidize the vaccine costs for the countries who can't afford it. The US under Trump pulled out of the WHO, but now with Biden, they're going to join back to WHO and contribute to vaccinating the world.
咁咧，陳醫生咧就話呢啲咁嘅疫苗咧，不同嘅疫苗咧，就喺不同嘅階段啦發展得。咁咧就之前咧就係即係嗰個資源咧係要非常非常之大，亦都要好多個國家合作先至可以製造出咁多嘅疫苗咧，係俾全世界嘅人都可以接種嘅。咁之前咧就係因為我哋嘅總統咧就係將佢自己喺嗰個世界衛生協會嗰度走咗出嚟啊，將美國攞咗出嚟啊，咁咧就同世界嘅合作咧就係冇咁即係聯繫得冇咁好嘅。但係而家即係總統換咗之後咧，咁我哋又會走翻入去呢個WHO 呢個世界衛生組織嗰度咧，咁啊希望同大家一齊聯手，可以將呢啲疫苗係真係俾晒全部嘅國家都有咯。
Yeah, so this is really just comparing the different vaccines. Again, the main difference between Pfizer and Moderna and the others is that Pfizer and Moderna, you need a very cold temperature to store it. Very, very, very cool, not like your deep freeze at home. And that's limiting its use in rural areas. They can spoil. That's why people camp out waiting for leftovers for the vaccine. But with J&J and AstraZeneca and the new one we didn't talk about too much, Novavax, you can just keep it in the fridge for many months. So they're going to make it easier. And J&J is just one shot. Although we can talk about the fact that you can still get protection with one shot from Pfizer and Moderna as well.
咁咧就依度依5個疫苗咧，就係喺美國依度做緊㗎啦。咁咧就係頭嗰2個疫苗咧，就係要喺好凍嘅temperature， 尤其是第一個啦嚇，要喺70度攝氏70度以下嘅溫度先至可以儲藏得好嘅。咁咧但係其他嗰3個咧，下邊嗰3個咧就係即係普通嘅雪櫃啊，都可以藏到佢哋噶啦，可以擠到幾個月，係幾安全下嘅。咁所以呢個咧就係一個非常之重要嘅環節，因為你將嗰啲溫度保持得唔好嘅時候咧，嗰啲疫苗會變壞咗就要抌咗就會嘥噶啦。 咁啊，所有嘅疫苗咧，而家暫時嚟講咧，都係要打2針嘅，就除咗呢個強生啦，呢個就係打1針嘅。咁然後咧就係好多人都話咁有邊隻疫苗比較好啲咁？其實即係老實講咧，個個疫苗咧，佢嗰個功效咧都係差唔多嘅。咁有啲係比較高啲咧，有啲比較低啲。但係佢高同低之間咧，我哋一樣嘢要知道咧，就係從來冇人因為打過疫苗而死亡嘅。即係到而家嚟啫，冇人係因為打疫苗 ，nobody's dead from taking a vaccination after the first.
Yeah, zero.
Zero. 所以呢樣嘢咧，你哋係非常之即係要記入心嗰度，就係唔使咁驚，因為而家喺出邊係好多謠言風言風語咧，就係話疫苗有呢樣有嗰樣，但係所有嘅副作用啊，都係短暫，而且係即係冇咩特別壞嘅效果，同埋最重要就係用個死亡嚟到睇呢件事。就係冇人因為死亡，因為打針而證明佢死亡嘅。
So people are probably looking at the efficacy and saying, wow, Pfizer and Moderna are really amazing. And they are amazing for efficacy. But J&J and Oxford AstraZeneca, they're still really good because the flu vaccine is only 40 to 60% effective. So if I got a J&J, I would still be very happy.
咁咧。即係我哋平時每年打嗰啲敷嗰啲針咧，嗰啲防疫針咧，通常都係4成至6成嘅功效㗎咋。所以我哋而家暫時睇到呢個呢啲所有嘅疫苗咧，通通都高過4成至6成嘅。咁所以咧，我哋係陳醫生話咧，佢就算係打其他嗰啲針即係強生啊，或者係阿斯利康納啊嗰啲咁嘅針咧。佢都會非常之高興嘅。
So it's not like going to school and getting, almost 100 in your tests. You have to think of it in a different way.
即係唔係好似返學咁一定要考試要攞 A 咯？即係我哋教仔女話，嘿，你攞個 B 唔得㗎，要攞個 A 啊咁。但係而家咧，我哋嘅意思咧就話，你總之合格升班，我哋都好開心㗎啦。即係而家係要用咁嘅態度去對啲疫苗，咁樣你就會有個安心。So this slide we had used before actually, but I just want to bring it up just to show that we have started, almost a month and a half now, right? We have started over a month and 20 days of vaccination. So a lot of people got the vaccine already, and so that's a good thing. That's all I want to bring this up, just to give us the relevance of December 14. 係12月14號開始打。初開始喺美國打疫苗嘅，我哋都係全世界第一個國家開始俾呢個疫苗接種咯。So
first of all, the main point is that California is not doing so well in percentage of people vaccinated, but that's because California has a lot of people. It's the most populous state in the United States. But there are, reasons why smaller states like West Virginia or North Dakota can do better because it's smaller. California is very complex, but we have been giving a lot of vaccines. I know a lot of people are disappointed that it's not smoother, but it's harder in California than in other states.
咁因為加州咧人口多啊，係全美國第2個大嘅州嚟嘅，講人口嚟講，咁所以咧。喺加州接種疫苗呢件事咧係一個非常之龐大嘅計劃嚟嘅，咁就而家大概係有9% about 9% of the people got vaccinated, I suppose, in California. 咁而家總之咧就係即係紐森州長咧就已經係好積極咁樣去盡量將啲疫苗去俾人去。打㗎啦，但係咧我哋仲係好多人要打咯，同埋要盡量要打得快咯，因為而家有呢個變種嘅疫苗喺個社區嗰度周圍咁走咧，就越打得快就越好，對我哋亦會有啲幫助嘅。So this was a study. There was a study that was done by one of our professors, which I respected a lot, Dr. Kirsten Bibbins Domingo. And so this is an interesting thing. They for about 6-7 months, from March to October of 2020 last year, they look at 828 people who have died in California, and look at, and they just selectively, pick them, and they found out that of all the people that have died from COVID, what do these people do in their job? And they came out with this list of the 10 riskiest jobs in terms of COVID infections. And so you wouldn't think that cooks and packaging operators and agricultural workers, I mean, we've heard about them. We didn't know that it was that bad. Bakers, people that work in bakery, baking in the back, construction laborers. So, Dr. Peter Chin,
the big point about this is most of the people who have risky jobs are inside with poor ventilation and in occupations where it's hard to keep a mask on. Like if you're in the kitchen and it's hard to keep the mask, but it's very small. And the more you stay in these environments, the riskier it is because of what we know about ventilation.
陳醫生話咧，呢啲人咧有一樣嘢共通嘅地方咧，就係佢哋大部分嘅人咧都係喺室內工作嘅。佢哋喺室內工作之餘咧，仲有啲人咧就因為工作嘅原因咧，係唔可以戴口罩。你叫個廚師點樣戴口罩咧？佢對住嗰個火爐，你戴個口罩咁，即係相當危險下咯，係咪？咁即係有啲人咧就係即係冇戴口罩啦，就係而且喺室內咁樣，即係受感染嘅地方嘅空氣流動唔通咧，就係受感染咧，就係比較容易好多嘅。咁呢樣嘢咧，真係大家要留意。我哋亦都好多謝呢啲 basic essential workers 對我哋嘅貢獻，因為佢哋嘅受感染嘅程度加高咧，佢哋去做呢啲咁嘅工作啦。咁我哋如果唔係，我哋連餸都冇得賣嘅，因為如果冇啲農場嘅工人啦，去接菜、去剪菜啊，冇人去運輸啊，冇人喺嗰啲超市嗰度買嘢，咁我哋係買唔到嘢食咯。咁我哋係非常之多謝佢哋嘅。So we talk about the issues. I mean, actually, the Department of Public Health talk about the issues a lot, and they talk about who gets it first and who gets it second and all that. And then one of the things that hasn't been touched upon is this. And I don't know what you think, Dr. Peter Chin Hong, and I think that our department chair, Dr. Bob Watcher, also talked about it, and that is we have this bunch of vaccines. And you either give it to the people as their first dose, or you save some, put some aside, as actually we do that at UCSF, so that people who have had their first vaccine, they could come back for the second vaccine a few weeks later, so that we wouldn't be out of it because we save it on the side for them. The question is, and England does not agree with this, because they think that if you have 100 vaccines, instead of giving it to 50 people only and save the other 50 for the other part for the second dose, then you should give it 100%, all 100 of them, to 100 people, so that all of them would get the first dose. So, what's your perspective on this?
I think my thinking has changed over the last few months after it seemed very, very hard to get all the vaccines out of the storage into the arms of people. So we need to have a different strategy, and we need to work fast because these variants, which we haven't talked about, are becoming more important, and these vaccines may not be as good against these variants. So time is everything, and we can't just wait. At this rate, it will take a whole year to vaccinate everyone, or some, maybe even into next year. If we're just waiting and we don't know about protection, I think we need to work fast and hope that these second doses will be available. But even just one dose, when you look at the data, it's fine, actually. 90% effective after 2 weeks of Pfizer and Moderna for one dose. It's nothing to complain about when you think the flu shot is 40 to 60% effective. We don't know how long it would last, but my suspicion is it will last, this first dose will last for many months.
One of the people who wrote a question was asking, if I only get the first vaccine and I didn't get scheduled for the second vaccine, and what should I do? Well, the thing is, don't worry about it. You get the first vaccine, you're already protected 80 to 90%. That's very, very good already. So if you don't get the second vaccine on time, that is probably fine, right? And then if you get it later, that might even be better because the AstraZeneca vaccine in England has tested that, if you get it later, the efficiency actually goes up. As a matter of fact, that which one was the vaccine? HPV? You don't get the second dose until a year later, right? You get the first dose now, and then you get the second dose a year later. Is that right?
It's I think I'll get back that information to you soon. But yeah, the time period of 3 weeks is arbitrary. It's not really, people didn't really know when they developed the science, how long to make that interval. Pfizer chose 3 weeks, Moderna chose 4 weeks. They could have chosen 2 months. They just wanted to finish the trial fast.
That is really a very important point. So don't worry so much about the second dose at this point now. If you get it later, get it later. I mean, if you get 2 doses, that is great. But even if you don't, you get 1 dose, that is very, very good protection already. So don't worry too much. You need to stay sane and, be happy.
Yeah.
我即係叫你哋唔好擔心，但一定要打晒2針。因為打咗第1針嘅時候咧，你已經係保護咗你80%至90%㗎啦。咁所以你打咗第2針咧，你亦都唔好擔心話，過咗3個禮拜啦，過咗4個禮拜啦，哎呀我遲咗啦咁，你唔使驚嘅，因為咧就算係遲咗咧，遲咗都冇問題嘅，可能遲咗仲好啲添啊。因為喺英國嗰度而家最近睇到咧，就係佢好似遲咗3個月打，嗰個成效仲比係3個禮拜打好嘅。咁所以咧，大家唔使驚。所以如果你係可以打到2針嘅咧，就恭喜你啦。咁你已經可以90%係保護到你啦。但係你就算打咗1針咧，你都係非常之好嘅，非常之幸運嘅，因為你已經打咗啦嘛，你已經係有保護。所以我哋陳醫生咧就係話，最緊要就係盡快打。你係盡快打咧，就希望唔會俾呢啲變種嘅疫苗去感染咗你。
So the HPV vaccine, dose 1, and then 6 to 12 months later is the second one.
OK， 咁即係我哋其實以前咧都有嗰啲 HPV 嗰啲vaccine，即係其他嗰啲 vaccine 咧，都唔係話咁快3個禮拜、4個禮拜就翻打。呢個即係佢哋當時嗰啲藥廠要出藥嘅時候咧，佢哋想打2劑。咁如果你拉長佢哋話，如果係打第2劑嘅時候要6個月、8個月之後打咧，咁咪好耐都未知道呢啲疫苗嘅成果咯。咁我哋咪到而家都未有得打針咯。所以佢哋呢個3個禮拜至4個禮拜嚟到重打呢個咧，真係為咗方便同埋等嗰啲疫苗快啲出嘅，所以大家真係冇咁擔心嚇。呢個係一個好重要嘅環節嚟嘅。咁因為其他嗰個疫苗咧，好似嗰個 HPV 嗰個疫苗咧，都係6個打完第1針之後咧，係6個至12個月中間嗰度係可以再重打嘅。
But it's important if people, again, not to stress about getting it on time, but if you can get the second shot, it just will, probably extend that interval of protection.
係啦 ，so 就係如果你打到第2針嘅咧，就係將你嘅即係再保護你可以再長啲時間咯。咁但係咧就即係如果你有得打第2針，咁當然係最好啦。但係就算係未打咧，都唔使咁擔心嘅，因為第1針咧都可能係會保護到你好幾個月嘅。You know about this one about Blue Shield and Kaiser?
Yeah. So people are worried that Blue Shield and Kaiser will take care of their own patients first if they're in charge of the vaccinations. But the sad point is that we don't have the public health infrastructure of all the people to roll this out very quickly. So you need help. So that's why the state went to these organizations. First of all, they take care of a lot of people in California. But secondly, they have the infrastructure to help just give shots to people in fast as time as possible. So, that is the reason why. Of course, there are always worries that Blue Shield will take care of Blue Cross Blue Shield patients first. Kaiser will take care of Kaiser patients first. But that's hopefully not going to be the case.
咁呢個加州嘅州長咧喺上個禮拜咧就因為俾人鬧話係你將呢個疫情控制得咁差嘅打呢啲疫苗又打得咁慢嘅，咁即係好多人係唔中意唔開心啦。咁咧於是咧佢咧就好心急咁咧就想揾啲機構咧嚟到幫佢。咁咧就揾咗呢個藍盾呢個健康保健啦，同埋呢個 凱撒呢個健康嘅機構咧嚟到幫佢去製造一啲方法咧，係盡快去同加州嘅人咧係打呢個疫苗針嘅，因為呢兩個機構咧，因為佢哋係保健嘅機構咧，佢哋名下咧又係有好多會員嘅，咁佢哋當然係可以同自己嘅會員嘅溝通係容易好多啦，有晒佢哋嘅電郵啊、電話啊，即係同佢哋有聯絡啦，係咪？咁咧，但係佢除此之外咧，亦都覺得咧，佢哋係呢啲機構係同好多醫院咧都有聯繫嘅，所以佢哋可以發動一個好大型嘅活動咧，係可以盡快咁樣去打疫苗針。咁呢個就係主要嘅原因啦。但係即係有啲人咧就風言風語又話係可能係因為捐咗錢俾佢啊乜啊咁。其實嗰啲嘢唔需要聽咁多啦。主要嚟講咧就係大家都係向住一個好嘅方面去行，就係希望我哋可以盡快得到呢個疫苗。So other issues. And you know that when I was writing an email and then I was putting down where you can go and get yourself signed up to be notified when it's your turn, I just, realized, wow, how many systems are there? It's just like very, very confusing. And for those people who do not know English, it's even worse. Then you are limited by your language and you can't really sign up as easily. So, but anyway, so it's very confusing. There's a lot more work that could make it smoother. And so hopefully the partnership with Blue Shield and Kaiser can help with this. And then, of course, another thing that's very confusing was that last Wednesday, Governor Newsom said that, okay, now let's, instead of the vaccine sitting around, let's start vaccinating the people who are 65 years and older. And whereas, coming back to UCSF, at least in our situation, we know that we don't have enough vaccines to start vaccinating the 65 and over. And so we are still, while the governor is saying 65 and over, we are still doing 75 and over. So a lot of people were like calling, it's like, how come I'm not notified yet, and this and that. And so it caused a lot of confusion and anxiety in the meantime. And then, of course, as they were talking about that, you need to have space for people to rest up after they took the vaccine, like for 15 to 30 minutes, depending on what allergies you have, right? So with that, it kind of slows down the injection of the vaccines. And so there are people who are waiting in line for hours and then they end up going home, not getting the vaccine. So those are really not good things to have. And because so many people are doing the vaccination, the data of who has gotten the vaccination, trying to get that back centrally to the Department of Public Health in California, that was not an easy process. And so so the governor it's really hard for him to tell whether he's able to achieve his, goal of so many billions of vaccination a day. He's trying to achieve 1 million vaccination, in 10 days. Whether it's achievable or has achieved or not, he couldn't tell because the data's not there. So those are the things. 即係呢個係呢個安排接種個疫苗同埋管理上咧係有好大嘅問題嘅，因為太多人啦，我哋又冇呢啲咁嘅登記嘅系統咧，咁所以咧佢哋不同嘅地方咧有用不同嘅系統，所以有啲人咧又唔知喺邊度登記，尤其你唔識英文咧，你就更加唔識登記啦。咁咧就嗰啲一陣間又65歲，一陣間又75歲，咁搞到啲嘢好混亂啊。咁有啲人咧就係因為要等咗好耐都攞唔到呢個接種疫苗咧，就卒之翻咗屋企，都接種唔到，排咗幾個鐘頭都攞唔到疫苗嘅。咁總之就係數據方面又好混亂，登記方面又好混亂，而接種嗰方面咧，亦都係個程序咧，亦都係可以更加改善嘅。
Yes, I mean, I think the main point is that the US is very different from a single payer health system like the UK with the National Health Services or Israel, where they can just vaccinate everyone very efficiently because there's so many different systems. So that's part of the problem. And also the second problem is we didn't put enough money in public health. We defunded public health for many, many years. So you can't all of a sudden expect them to have that system to be able to do something so ambitious.
因為美國係比較混亂，因為我哋係冇呢個全國嘅醫療系統，同埋佢係喺好多年前咧就係將呢個公共衛生嗰個方面咧，就係將佢擺到個重要性係擺得好低嘅。咁咧重要性低即係冇錢啦，係嘛？咁冇錢咧就樣樣嘢都萬事不能噶啦。咁所以 即係美國呢方面咧，希望呢個疫情咧係帶到一個教訓俾我哋，等我哋喺呢個疫情過後咧係將個制度可以改良，就如果以後再遇到呢啲疫情嘅時候咧，係可以應對得比較好啲。Well, I kind of put it here, Dr. Katy Tang, because a lot of people are kind of very confused about this. 95% efficacy, 85% efficacy. How do you get that? And actually, I've seen people misconstrue the way that it's calculated, and so they were kind of making it up. Are you able to kind of, in a simple way, explain this to our audience?
Yeah. So the way to get that percentage is think about two groups of people. One group got vaccines, one group didn't get vaccine. Two groups of people, one got vaccine, that's 22,000. Other got placebo, not vaccine, that's 22,000. But people get COVID in both groups. So what's the percentage of people who got COVID in the vaccine group? It's very small. What's the percentage of the people who get COVID in placebo group? It's much larger. So it's 162 over that whole number versus 8 over that whole number. So the 95% it's basically much more effective if you get the vaccine to prevent COVID than if you didn't get the vaccine.
呢個咧就係嗰個輝瑞嗰個做嗰個疫苗嘅即係計嗰個疫苗效力嘅方法啊。OK， 佢哋咧就總共有44000人去參加呢個疫苗，所以唔係少人嘅，有44000人嘅。OK， 咁咧就將佢分開一半，一半人咧就接種疫苗，一半人咧就俾啲假嘅藥，即係鹽水啦，同佢打鹽水針啦。OK， 就唔係疫苗嚟嘅。咁咧佢哋咧就跟住咧就我哋就去跟佢幾多個禮拜咁樣啦。OK， 然後就睇下有幾多人感染咗呢個新冠病毒。OK， 咁然後咧我哋咧就跟幾個禮拜之後咧就發覺咧就係喺呢個打咗疫苗嗰度咧就有8個人，即係22000人之中只有8個人感染。但係咧冇打疫苗嗰度咧就唔止咁多啦，咁少咯喎，就係有162個人就感染。我哋唔係特別俾啲病毒佢哋嘅，即係你平時你照樣平時咁樣做啦嚇，即係返工或者係自己做嘢咁，或者同家人啊咁樣。咁佢哋咧就得到呢個咁嘅結果出嚟。咁得到結果出嚟咧，你就將嗰個有病毒嗰啲，即係有佢呢個點樣知道嗰啲人有病毒咧？嗰啲人咧就係要同佢做呢個即係查嗰個血啊 ，OK， 咁睇下嗰啲血嗰度有冇病毒嘅，即係做呢個 mRNA 嗰個 test 嚟到 confirm 佢有冇證實佢有冇病毒嘅，唔係話有症狀冇症狀，唔係咁樣樣嘅，因為好多人冇症狀都有病毒噶嘛 ，OK， 咁我哋而家咧就係話總共咧有呢個 confirm test 嘅咧就有8個同埋162個，咁得到出嚟計到出嚟咧，你就得到呢個。每一組人咧嗰個風險有幾高，咁咧就將個風險咧就由一個除一個 ，OK， 即係嗰個0.036% 同埋呢個0.74% 咧，就將佢除一除佢，咁你除咗出嚟就除到就0.049嗰度，咁咧呢個咧就係嗰個感染嘅風險啦。咁啊個效力咧就係冇風險啊嘛，咁就將佢由呢個1指嘅整數咧就減咗呢個感染嘅風險，嗰個咧就係嗰個疫苗嘅效力啦，就係0.951。即係95.1%，呢個咧就係嗰個輝瑞嗰個效力計到出嚟係95%，係咁樣計到出嚟嘅。但係好多人咧就係誤解咗，就以為係有症狀嗰啲冇症狀嗰啲人，我哋唔係講症狀，我哋係講抽血去查呢個 mRNA，OK 嗰個咁嘅 test， 我哋係一路跟住，唔係我哋係講輝瑞，佢係一路跟住呢啲人咧係每個禮拜或者係即係要翻嚟要驗血咁樣樣嘅。呢啲係做實驗，佢哋去做測驗嘅時候咧，呢啲人係要咁樣做嘅。The next slide is talking about the same thing, but then this one shows you the Moderna. Moderna they didn't use 44,000 people, they used 30,000 people, Dr. Katy Tang. But the calculation is the same, right?
Yeah, the same calculation. Again, it's kind of arbitrary how many people you use. Pfizer used more so they can get the study done faster. so they can be the first to get approval. Just like they use 3 weeks instead of 4 weeks.
Right. Pfizer 嗰度打2針啊嘛，每打2針係隔3個星期打第2針。Moderna 咧就隔4個星期打第2針，所以佢哋遲咗一少少，比 Pfizer 遲咗啲。但係佢哋亦都係冇做咁多個人嘅，咁佢哋係做少咗啲人嘅。但係得到出嚟嘅結果都係非常之好咯。又係咁樣計法，又係將嗰個感染咗嘅人同埋冇感染嘅人，將佢即係比一比較，咁啊得到嗰個風險出嚟，咁然後將一個嘅風險，即係中咗疫苗嘅人嘅風險同埋冇中疫苗嘅人嘅風險比較一下，就得到呢個0.05% 出嚟，即係0.05出嚟，咁然後即係5.5% 啦。咁你又將個1去減翻佢，嗰個係風險啊嘛。咁你嘅效力咧就係將個1減咗個風險，就係個效力啦。就係所以變咗咧 ，Moderna 咧就係有94.5% 嘅0.945嘅效力，就係咁樣計出嚟嘅。This was somebody who's did a study in the University of Washington up in Seattle. This is a really interesting study. I mean, people have some very creative ideas. They went on Amazon and just trying to see what is influencing people's opinion. And they put in some search words, some 48 search words that's related to COVID, vaccine, immunization, or side effects or whatever. So all together, and they found that actually the results that show up in Amazon as they were looking for books about this, a lot of the books that flow up to the top are the books that carry misinformation, rumors about the COVID and this vaccine. And the real information ones, or the better ones that combat this type of bad information, they are kind of like at a second tier. So you don't see them quite readily. And so if people are looking for books about COVID and vaccine and all that, they will see the bunch of books that carry the wrong information. So I thought they were pretty creative. And then that all of you that use social media, WhatsApp is the top social media, followed by Facebook, followed by WeChat. And then we have QQ, mobile, and TikTok, and Twitter accounts. So all of these are the social medias that a lot of us use daily. And daily, we see a lot of messages coming around. And a lot of them carry a lot of misinformation. So we just want to point it out to you that when you use social media and you see something, don't quite be so readily transfer that and just forward it into somebody else, because you'll be forwarding misinformation. Unless you check on it and you make sure that the information is correct. But if you have any doubts, just keep that with you and don't forward it. Stop it. So we don't have all these scares running around of this social media information and bad books. And so we must try to use our help. All of us come together and help to stop this type of misinformation. That a bit that you know?
Yeah, so there's been a lot of misinformation on social media, and maybe less so in the Asian community, but in other communities of color, it's made people feel very scared of getting the vaccine. So I think many of us at UCSF are trying to make campaigns to, again, debunk some of these myths because they're dangerous. We all need to get vaccinated if we want to get back to normal society. So this is just doing a big disservice and also disrupting the vaccination attempts, like the anti-vaxxers at Dodger Stadium last week. It held up the vaccination in LA for a few hours because of the people protesting. So it's one thing to have an opinion, but if you're disrupting the rest of us from getting vaccines, it could be very dangerous.
咁呢啲咧就係即係而家個世界嗰度咧，因為太多呢啲咁嘅社交嘅通訊咧，以前都冇咁犀利嘅，而家咧就真係好難啊！因為你哋得到嗰啲信息咧，你都唔知邊啲係真邊啲係假。咁最好你如果係唔知真假嘅時候，你就唔好亂咁繼續傳出去咯。OK， 尤其是係話叫你真係要傳俾朋友嗰啲，更加要小心啲，唔好就咁亂傳。咁咧就係呢幾本書咧，就係如果你將揾啲字咧，如果入Amazon 亞馬遜呢個網站嗰度去買書嘅話咧，你想買啲疫苗嘅書啊、乜書啊咁想睇下嘅時候咧，其實第一批出嚟就 走出嚟嗰啲書咧，其實書裏邊咧嗰啲資訊咧都可能係唔係咁正確嘅。所以你如果睇咗呢啲書，你就當係讀書咁，即係書裏邊啲嘢係黃金屋係真㗎啦，啲嘢係好㗎啦，咁咧就真係錯晒，大錯特錯，所以要小心啲嚇。We have used this slide before last time, but we ran over it so quickly. So Dr. Peter Chin Hong, can you just quickly go over this?
So many people can get side effects from the vaccines, but the side effects that they're getting, they're usually very short-lived, and they go away without even taking any medications. And again, the risk of getting COVID is much more than, and having bad things happen is much more than these side effects. So I got the vaccine. I actually didn't get any side effects. So it's not, as high probably as these numbers suggest in real life for some of these things. But, certainly some people can get it. I think we get prepared in case you need to take a day off from work, but luckily I didn't have to. Yeah, so it seems that the younger folks may have experience more side effects, mainly after the second dose. I guess the other big point for the community is that the side effects is actually it's like a sign that your immune system is being trained. So when you feel it, if you think about it that way, it's kind of like a good thing, right? And, it's not good to feel it, but if you think about it, it's like your immune system getting ready to fight the battle. That's one way of thinking about it. The reason why young people, we think, get it more than older people is because their immune system is more active. So it makes sense that they have more side effects.
So there was a question about why does the second dose bring up more reaction than the first dose?
The answer is that the immune system is starting to recognize the spike protein the first time. When you give it to them again, they're already being built so that they respond even more to what they're thinking it's COVID. So they're trying to kill it, but they're building these antibodies. So and that's why we think the second dose, eventually when you get it, is important, because it means that there are more antibodies and they're probably going to last longer because they're getting better at recognizing this, which is on the surface of the COVID.
咁咧，呢個咧就係嗰啲接種咗呢個疫苗嘅不良反應啦。咁呢個咧就係用輝瑞嘅疫苗嚟到去睇呢啲 number 嘅。咁咧，我哋咧就知道咧，中疫苗接種咩疫苗都通常都有啲反應㗎啦。但係我哋知道嗰啲反應咧，就係通常咧都係好短暫同埋係輕微嘅，係唔需要入醫院啊，即係亦都冇死亡嘅。OK， 咁咧我哋知道咧就係年青人嘅反應咧就可能多啲嘅。咁然後咧就年紀大嗰啲咧就可能冇咁多嘅，就可能因為我哋嘅免疫系統咧，年青人咧係比較強壯啲咯，咁所以佢嘅免疫好啲，咁所以佢嘅反應高啲啦。咁就同一嘅道理咧，就係所以咧我哋接種第二個疫苗咧係比第一個疫苗咧嘅反應咧係可能係強啲嘅，因為種完第一次之後咧，咁個身體咧已經係將佢訓練咗啊，去認識呢種病毒啦。因為初你知道個身體唔識呢個病毒㗎嘛，所以初嘅時候係有幾日啊都可能係冇反應㗎嘛。咁所以咧，但係我哋如果同佢接種咗疫苗之後咧，個身體咧就開始認識呢個病毒，開始對佢一入嚟咧，我哋就會知道啦。所以當你第二次同佢種呢個疫苗嘅時候咧，佢咧就一入嚟嘅時候咧，佢就認到啦，呢個好似同嗰個病毒差唔多喎，於是我就去做反應啦。咁所以咧就第二次嘅反應咧嘅副作用咧，就可能係比第一次高。咁呢個副作用咧就即係話我哋對個疫苗有反應，所以其實係一件好事嚟嘅。你有反應，即係當然係我哋唔會話希望你太過唔舒服啊咁樣樣啦。咁但係通常咧都係發下燒啊，隻手臂下痛下啲肌肉臂下咁，就通常係一兩日兩三日咧就會過㗎啦。咁有好多人咧就可能係種第二次疫苗嘅時候咧，個反應比較強嘅時候咧，就可能要喺屋企休息一兩日啊，咁要告假嘅。咁所以你咧，如果係要翻工嘅咧，你都係諗住去種疫苗嘅時候咧，你就唔好話安排一啲係好重要嘅嘢要即刻做嘅咁樣。咁你第二日咧病咗，咁變咗就自己揾自己麻煩咯。所以自己去安排啲時間。Okay, so we are kind of coming to the end, and there's a few slides after the Q&A that we want to round up, and they're important to talk about. So we've answered a lot of the questions already. So this is one of the vibes that were floating around actually. And I actually get asked by one of my friends, and is that if this is the case, if you have hyper pressure, diabetes, and taking other medications, then maybe we shouldn't be taking COVID vaccines.
No, in fact, people with high blood pressure, diabetes do much worse with COVID, maybe twice as much chance of doing poorly as somebody who didn't have those things. So if anybody should get it, it should be those people.
So 其實咧就係、如果你真係有嗰啲糖尿病啊、血壓高啊或者其他嘅病要食藥嘅咧，你更加係需要早啲打疫苗啊，因為呢個疫苗係可以幫到你，唔會感染到呢個病毒。So next question, should we begin wearing medical grade masks that give more effective protection given the variants around?
So
Some European countries are doing that.
Yeah, I talked about this on KTSF, but in France, in Germany, they've made recommendations that everyone in the community should wear, a standard surgical mask instead of a cloth mask. And nobody says you should wear this around. This is, what we use in the hospital for high-risk situations. In fact, I just usually use this in the hospital normally. Many Asian community members, many of the people use this mask anyway, which is fine. I think that it's better to have a good quality mask than to think about, double masking or triple masking your mask. Then you can't breathe. So it's more important to have a good quality mask that fits well, that's comfortable for you, that you can wear a long time. But there's certain situations where you might be more at risk. And then it's from that slide where you talked about the occupations where they're riskiest for COVID deaths. And these are people who stay inside for a very long time, maybe poor ventilation. It might be worthwhile to wear something like that in that setting. So if you're in Golden Gate Park, you're walking around in the park, it doesn't matter what mask you wear because nobody else is around you. But for general use, I would recommend a good mask. But again, wear something that's more comfortable for you. It's better to wear a mask that's comfortable than no mask at all. And if you're indoors for a long time and you're a cook or one of these baker high-risk occupations, it might be worthwhile before you get the vaccine to wear a higher level of protection.
咁咧，簡單講就係戴口罩當然係比冇戴好啦，尤其是睇下你咩環境啦。如果你係喺出邊嘅，就你戴任何嘅口罩都係 OK 嘅啦。但係如果你喺入邊嘅，喺一個關閉嘅環境嗰度，空氣唔流通嘅咧，你就可能要戴一啲比較好啲嘅口罩咯。咁咩就係好啲口罩咧？第一就係佢要 fit， 即係要合你個口嘅面型啊。唔會話有好多窿啊、好多罅啊咁嗰啲空氣可以帶啲病毒走入去嘅。第二咧就係幾多層啦。咁你即係如果係戴2-3個口罩咧，你焗到自己都唞唔到氣咧，你就唔會戴，你會戴咗一陣間之後你唞唔到氣，你咪除晒佢出嚟啦。咁啊反為不美啦。咁所以咧其實咧要揾一個好質地嘅，但係咧就唔會話真係唞唔到氣嗰種嘅口罩。咁咧就如果你係可以攞到嗰啲醫院用嗰種嘅面罩，咁你可以用啦。但係我哋即係而家都係唔係好建議你一定要用嗰種咁嘅面罩嘅，因為我哋驚住醫院都始終有一日係唔夠用噶嘛。咁所以咧，你如果係揀面罩咧，你可能就去戴布啊或者其他嘅面罩咧，你就揀一啲比較適合你嘅面型嘅，可以係預防得好啲嘅，同埋可以自己唞到氣，可以長時間戴嘅，戴得舒服嘅，呢個係最重要嘅環節。係你會長時間戴而戴得舒服嘅。So the World Journal 世界日報 they put in a Q&A corner for COVID, and I think Dr. Peter Chin-Hung, you've been interviewed by them for a couple of the articles, and so they wrote some questions and want you to answer that so that they can put it in the newspaper.
Coming back to what we said, it's so important for us to vaccinate as fast as possible because the fewer people have COVID in the community, the less virus there is to mutate, because viruses are mutating all the time. Every 2 weeks, there's a new mutation. Some of them are worse than others. So that's like the the main point.
咁第一條問題咧就係話，你對嗰啲新變種嗰啲病毒要點樣對付咧？個答案就係打疫苗。OK， 打咗疫苗針，咁你就有相當嘅保護。即係雖然就唔係完全可以保護到，但係個保護能力係相當強嘅。咁咧，因為呢啲變種疫苗咧，佢係一路變種啦，成日都變種嘅，每2個禮拜變種一次。咁有啲咧就唔係幾關係我哋啦，因為佢好快就變咗種之後就自己消失。但係有啲咧就留咗落嚟嘅喎，好似南非啊同埋南美嗰啲咁嘅種咧。咁所以咧，你最早就係越快將佢呢個打咗針就越好。So the next question.
Or before that, but the vaccine companies are trying to address the variants by making new versions of the vaccines, mainly for the South African variant. That's the one that's a little bit more resistant. The UK variant, it seems that all the vaccines still work well against that one.
咁咧就佢補充咧就係話，而家好多嘅藥苗公司咧，製造藥苗嘅公司咧，都喺度嚟到做緊一啲一個改良嘅疫苗咧，係可以控制到呢個南非嗰隻變種疫苗嘅。至於英國嗰個疫苗同埋巴西嗰個變種疫苗咧，就係佢哋而家發覺而家嗰啲疫苗咧對呢啲病毒嘅變種病毒嘅控制咧都相當好，但係佢哋都係想再做即係將佢改良，然後就可以將南非嗰個變種病毒都可以控制到。
But particularly for the Moderna and Pfizer, it's very easy to make a new vaccine because they're just using the message. And then if there's a new variant, they just take that message, a genetic message of the new protein on the spike, and they just put it in the bubble and they just inject it. But then you have to make more of it and manufacture it. So it's an easy scientific problem. The hard part is the public health part, which is to make more of the vaccine and distribute it.
咁就而家我哋用緊嗰兩隻疫苗咧，輝瑞同埋呢個莫丹娜呢兩隻疫苗咧，因為佢係用嗰個 mRNA 嚟到做嗰個，即係嗰啲佢嗰啲咁嘅用嗰啲 gene 嗰啲咧嚟到做呢個疫苗咧，佢係可以隨時將啲 gene 咧改變咗，咁然後咧就再擺翻喺嗰個 fat bubble 嗰度，咁然後咧就再接種，咁即係其實咧就個科學嚟講咧就唔難嘅，佢哋知道點做嘅。但係始終都係又要重新製作過一種新嘅疫苗咁啊，好似莫丹娜咁，佢係可能打咗2支都唔夠嘅，可能要打第3支嚟到對付呢啲變種疫苗咁。咁我哋而家睇下佢即係將來嘅時候會即係做咗啲咩出嚟，再逐樣去應付咯。始終就係打疫苗係一個好嘅方法。而家啲公司係更加係會做一啲改良嘅疫苗嚟到對付呢啲變種嘅病毒嘅。
I know there's a lot of information on that question, but the last thing is the Brazil variant might be bad, but we don't have information about it yet. It's in the Bay Area already. And the California variant, which from Denmark originally, we also don't have much information about the vaccines and that. And it's very common in the Bay Area. So we still have questions.
咁其實而家主要嚟講係有4種不同嘅變種疫苗係主要威脅住我哋嘅 ，OK， 即係唔止4種嘅，但係威脅到我哋嘅有4種。一個就係英國嗰個啦，跟住就係巴西嗰個啦，就南非跟住出啦，跟住係丹麥嗰度嗰個咧就已經嚟咗加州啦，而家變咗做加州嘅變種疫苗，變種病毒啦。咁所以咧就呢4個病毒咧，始終都係而家威脅緊我哋。咁我哋咧就將來嗰啲疫苗係會發展成點樣可以控制佢哋啊？ Are we running out of doses?
Oh, the seniors over 75. Well, that was from before. They were only for example, in UCSF, we were only doing over 75, but then we are changing now to over 65. So I think that was before as we're getting more doses. But there were some counties and just districts in California that were doing different age groups. So that was very disappointing and confusing to people. But right now, when we're getting more doses, we think that there's more production and J&J is coming. And maybe AstraZeneca will be approved. So I think, hopefully we'll get more doses. And we decided to just not save the second dose, or we're encouraged not to anymore.
咁我哋而家係改變緊嘅，咁啊初初係因為唔夠疫苗，所以就淨係接種75歲以上嘅老人嘅。咁但係而家咧，因為咧第一隻疫苗多咗啦，第二咧我哋就可能唔會再即係留翻啲藥嚟到接種第二針啦，嗰啲疫苗啦。咁總之咧，佢哋而家咧就係即係嗰啲疫苗就多咗啦。咁咧就即係有不同嘅地方咧，就係有啲咧就仲係接種75歲以上，有啲咧就已經開始咗接種65歲以上噶啦。咁所以情況係比較有啲改良，但係改良之時咧，因為有不同嘅環境咧，就製造咗啲混亂出嚟咯。
So the next question is it safe to go outdoor dining now? Any expectation of the city's economic reopening? I think it's safe to go outdoor dining, but being in Valencia Street with crowded tables, lots of people around on the street is very different from a normal outdoor. So just, it's what the behavior is, not just indoor or outdoor, but outdoor is much safer than indoor. And we're lucky in California with heat lamps, we can do that. In the East Coast, like New York, they can't really stay outdoors that easily because of cold. So they started opening the indoor restaurants, but I think I'm a little bit more afraid of that right now.
總之一句説話就係要小心，室內室外都係要小心。你如果係就算室外咧，人多咧，即係譬如你去嗰啲Mission 區嗰啲咁，好多人去嗰啲餐廳食嘢咧，坐到密一密咧，就算係喺出邊食啊，你都要小心啲。所以用你嘅聰明智慧去做決定，好唔好咁樣做？We're changing all the time that you just need to wait until you are notified. So if you belong to UCSF as a patient or a worker, you will get notified when it's your turn, right?
And it's coming soon. I mean, it's being rolled out now. I think more than just above 75.
Yeah.
They will tell you what vaccine you're getting, but you don't have a choice. It just depends on what's available. And I would encourage everyone to just get what's available.
So what's the difference, right? Moderna is 94.5 and Pfizer is 95%. They're just almost the same. Yeah. So how long does the protection last?
So we don't know, but the point is half of 30,000, 15,000 people in Moderna trials, and half of 45,000 people in Pfizer trials are going to be followed. So they will be checking the antibody levels. And so far, so good. They are ahead of us by about a year. So we don't have to worry about that too much because the volunteers in the study will let us know when we need to get a booster, if at all.
咁而家就係話呢個種嗰啲疫苗嘅保護功能到底係可以維持幾耐咧？咁我哋其實而家唔知嘅，因為要再等，因為只係出咗咁短時間係咪？咁所以要等耐啲，然後我哋先知道。咁大家拭目以待啦。
My prediction is if we don't get many resistant variants around, we can probably have protection for several years for most people.
咁陳醫生話咧，佢係好樂觀啊嚇。佢話如果唔係太多嘅變種疫苗嚟搞亂檔嘅話咧，咁我哋可能佢得到嘅保護時間咧，可能會幾年長嘅喎，可能啫嚇，又係要拭目以待。
I think
so can we still get infected?
Yeah, so that question is really interesting. And there are some important people who got the infection after. Actually, there's somebody like a congressman in Massachusetts who got infected after the second dose but there are different reasons why that might happen. First of all, the most important thing is that you don't get protection immediately. You need at least 2 weeks. So it's likely that that person was exposed during the time when, in that first 2 weeks after the vaccine, the first shot. So that's one point. The second point is that 95% is not 100%. So there's a small, very, very small chance that you're one of the 5% in these two vaccines who don't make antibodies even after 2 weeks after the second shot. So that's the second possibility. So it's possible you might get infected, but you wouldn't get so far it's not going to be serious disease. The vaccines pretty much prevented 100% of people from getting serious disease.
咁咧，首先係兩樣嘢。呢個咧就係話你接種咗疫苗之後，有冇機會去再受感染咧？再有呢個新冠病毒感染你咧？咁係有嘅，係有呢個機會嘅，但係呢個機會係細嘅，因為你即係呢啲疫苗咧，唔係100%有效噶嘛，佢只係95%有效啊嘛，即係100個人之中咧，有95個人有效，有5個人係冇效嘅喎。咁呢個5個人係咪可能係接種咗疫苗之後都可以受感染咧？係咪啊？咁咧，另外一樣嘢咧就係，當你接種咗疫苗之後咧，都唔係話即刻有效噶嘛，佢係要等10日啊、1-2個禮拜啊咁樣先至開始有效噶嘛。咁但係當你如果係佢未曾發生功效嘅時候，你就已經去碰到呢啲病毒，咁你咪可能會接受感染啦。所以咧，就算係接種咗呢個疫苗都好啦，你都係仲要做翻你應該做嘅嘢嘅，就係勤洗手啦、戴口罩啦，同埋同人企開啲，唔好咁企得咁埋，係咪啊？最少6尺以上。所以呢啲嘢仲係要做嘅。但係咧，我哋知道咧，就算你係感染咗之後咧，個感染咧個情形咧係唔會太嚴重咯，因為我哋知道係到而家為止未有人因為係打疫苗而死噶嘛。即係最低限度以前感染咗病毒嗰啲人，有一部分嘅人有大概2-3%嘅人係會死亡噶嘛。但係呢2-3%似乎消失咗喎，即係嗰啲人冇咁病得咁重咯。所以呢個係我哋而家知道嘅嗰方面嘅消息。
Do you know anything about vaccine hesitancy? People in the Asian community who don't want to take vaccines.
I think that certainly we can't expect 100% of the people to go for it, but I think that the hesitancy that I've seen in the Asian people are not like the general community. There's a lot more hesitancy in the general population than it is in the Asian population. And you can actually guess that by just the way they wear masks and apply by the rules. They don't fight with you and say, "Oh, why do I wear masks?"
But that's Chinese, East Asian. But I'm wondering about other like Southeast Asian and so on. But I don't know.
Yeah, we really haven't done a research on that. So we don't know. We actually can ask them if they would be taking the vaccine. I suppose that, the results will show in a few months as to how many people of the Asian community has taken the vaccine.
Yeah, you still need to wear masks because right now we are not really 100% sure that it wouldn't land on you and you can give it to somebody else, even though you wouldn't get sick. Until all of us are immunized, when you go out of your house, you still need to protect other people from maybe getting it from you. We think it's probably going to prevent transmission too, from early data, at least from AstraZeneca yesterday. But, we're not 100% sure yet. But so that's the reason why we need to do that, mainly because you don't want to give it to somebody else. And also, you might be one of those people who can get infected even after the vaccine. Very small number.
So, 呢個咧就係即係你哋都應該知道嘅答案㗎啦。我哋就係話你仲係要咁做嘅咁。咁其實咧，琴日咧有個好消息出嚟嘅，就係英國嗰度咧呢個AstraZeneca 呢個疫苗咧，佢咧發覺咧原來係可以減慢呢個感染率啊，係減慢成2%嘅喎，2%啊，咁即係有成3個人之中可以減低2個人嘅感染嘅速度嘅，咁所以咧呢個係一個非常之好嘅消息嚟嘅。但係始終你雖然自己中咗疫苗，你唔會受感染啦，譬如，但係你都可能係有病毒喺你個口嗰度噴出嚟噶嘛。咁你周圍嗰啲人啊，如果你唔戴口罩嘅話，佢哋咪可能受到感染啦。所以我哋唔係淨係為己，亦都要為人而戴口罩嘅，就係希望你唔會感染到你身邊你嘅親人啊、朋友啊咁樣，係咪啊？或者係就算行個街唔識嘅人都好啦，咁我哋就會咁就係叫做呢個積德啊，係戴口罩係積德，咁我哋自己小心啲啦嚇。Will this end? Will all this?
Well, it's probably going to end in different phases. So what will probably happen first is in a household, maybe that whole house would have all gotten vaccines. So they would probably relax protection, or that group of people or group of friends in a small bubble, like immunity bubble. But when they leave to go outside in the world, they still have to wear masks and everything because of the reasons we talked about. Then maybe San Francisco will start opening movie theaters and games, because more than 70 to 80% of people in San Francisco would have been vaccinated, but they still have to wear masks because, again, people will be traveling. You don't know who you can spread it to. But then the US will get it, but then we can't really do much until really the world is protected, because people go back and forth all the time. So I would say maybe San Francisco, the fall, maybe the world, the end of 2022.
咁咧，我哋三藩市咧，陳醫生咧就話可能我哋會早啲啦，即係如果多人接種咗疫苗，因為我哋聽話啊嘛，好多中國人啊、華人喺三藩市住咁啊，個個人都去接種疫苗，咁啊接種疫苗嘅人多咗啦，咁就變咗係成個社區都比較安全啦。但係始終都係一個國際嘅城市，就好多人咧就飛嚟飛去嘅，咁即係都唔會話全部係冇呢個零感染嘅，係咪？所以大家都係要小心，都係要繼續戴呢個口罩同埋做社交距離嘅。So holidays are coming up, the Super Bowl's coming up, Dr. Chin Han.
Of course, everyone knows what to do. I would say, please don't. We don't want to have another surge like from Memorial Day. We don't want to have another surge like Thanksgiving and another surge like Christmas. We're so tired of all of this. We have some liberties. Let's cherish those liberties and not turn back the clock.
And actually, this type of parties, Super Bowl parties, are even worse than the holiday parties. The holiday parties for Christmas and New Year, you're mainly getting together with your family and close friends. But Super Bowl parties are a different thing, right? You get together with people that you barely know about sometimes. And friends bring friends, and it's just end up having a huge group of people getting together.
Yeah, that's true. And shouting can make the virus travel further. Yelling, and also indoor setting, poor ventilation may make the aerosols suspend in air for longer. That's why those occupations like cooks and bakers, they have higher risk, because it's indoor with a lot of suspension. But in Super Bowl, you're even shouting more and making these droplets lighter and float in the air.
太過緊張啦！嗰啲人睇波睇到大叫大跳，拍手掌又又攬住咁樣，所以變咗咧呢啲咁嘅行動咧係會令到嗰個感染嘅情況係更加犀利。所以我哋好希望喺今個星期日2月7號，大家去睇呢個足球嘅時候，超級足球嘅時候，係唔好去走埋一大堆人。做以前做嘅嘢，今年都仲係要保守啲，唔好大家開 party， 好嗎？ And for the Asian community, this is another big ramble too.
Yeah, so if we look at what China is doing, it's actually very serious. They're really discouraging transport. They're giving bonuses to people who stay and they pay. They're giving shopping vouchers locally for people to use. And they really don't want people to travel. So it's a big deal. So we hope that, at least in our community, we respect that as well. Again, for all of those reasons.
咁農曆新年又就嚟到啦，牛年啦。首先喺呢度同大家預早拜個牛年，祝你哋新年快樂，亦都希望今年大家會過得開心啲，安樂啲。咁就總之就係。就算喺中國都係啦，中國咧就真係好積極啊，叫啲人千祈唔好翻鄉下過年啊，唔好翻屋企啊，盡量啊留翻喺你工作嘅地方啊，甚至俾錢你留低唔好，等你唔好走啊，咁即係好多獎勵俾佢哋，等佢哋唔好似以前咁樣，哇！大家去搶飛啊，搶火車飛啊，咁搭車翻屋企啊，咁過年，呢啲咁嘅行動咧係會引發一啲大嘅爆發嘅。And so again. There's hope. And there's light at the end of the tunnel. And seems like this light is getting bigger now, Dr. Peter Chin.
Yes, it's getting bigger. We complain a lot in the US, but actually we're ahead of many countries in the world who haven't even started a vaccination program.
Right.
And we have a higher proportion of our population vaccinated already. So we invested a lot of money in Operation Warp Speed. So we should be doing better, but we're still doing pretty well. We're not as good as the UK or Israel, but we're not doing as badly, particularly with the new administration, we hope.
Okay. 希望在人間. So thank you to all for coming and joining us. And I want to again especially thank Dr. Peter Chin for coming in and jumping in to join us today. And hope everybody stays safe and healthy. 多謝各位參加，希望各位保重。咁我哋當然係好多謝衛生局嘅白幹榮醫生同埋其他嘅三藩市公共衛生局嘅專科人士啦。咁咧就亦都係多謝而家幫緊我哋做呢個 Zoom meeting 嘅所有嘅員工同埋義工。So I thank all the production team that helps us today and our panelists who join us for the panel. And this is the Asian Health Institute website and listserv. Please email me if you have any questions and we'll still try to answer you. And we are on Facebook. Please give us a like and you can follow us on YouTube by just liking us and ring the bell. And when we put up new things on YouTube, you will be notified. So thank you all. Have a nice evening. And thank you, Dr. Peter Chin again. 多謝各位參加。咁出年再見啦嚇，出年牛年再見。Thank you so much。我哋大家加油嚇。